Welcome back. You're watching Real Health, and it's generally believed that the only way to manage the symptoms of depression is through antidepressant medication. But more and more integrative medical approaches are challenging this treatment method. Let's have a look.
We are going to just do a recap of our process up to now, the eating, the exercise, and we're going to look at, if you would like to go there, we will look at the trapped emotions. I'm Dr. Arien van der Merwe. I'm a medical doctor, but I specialize in natural integrative medicine. 1 in 6 adults have depression, and that's only people who have been diagnosed, which is not even 20% of people who actually have the disorder. But from an integrative perspective, we do not just sit there and give people a prescription, whether natural or not. We really look at the person's or the individual's whole life.
My name is Esther Legransi. Before I met Dr. Arien, it was about a period of 15 years that I was on and off antidepressants.
Esther has been dissatisfied with the antidepressant she's been using on and off for many years, so that was the main reason why she came.
I knew I couldn't afford to feel like this because my business was going nowhere, and I had to, you know, get some emotion in there, get some just feeling alive, or more alive than I was feeling on the antidepressants.
Depression is often something of a call from your soul being to pay attention to aspects of your life. If we look at the symptoms of depression, it is said that if you have for longer than 2 weeks, for instance, an all-pervasive sadness, sleeping too much or not sleeping enough, eating too much or not enough, being irritable for a longer period of time, then also looking at feeling worthless, my life has lost meaning and purpose, or helpless or hopeless, and guilt. So it's in the unconscious mind, but those are the symptoms that people feel, and then they would go for a diagnosis of depression. But if we look at it from the integrative perspective, those are all cries from the soul that are asking for attention. So there we would look at those feelings and give a different interpretation. So we've got to look at the deeper part of the individual, and that's what we would do with integrative medicine. I really want us to start working with a more challenging area of dealing with trapped emotions. That's always a part of the symptoms of depression. Trapped emotions would be the next part of the treatment. That's actually the root cause of any disease. It's those deeply unconscious or subconscious emotions that become trapped in ourselves. Resist. Now say, I still feel a lot of anger.
I still feel a lot of anger.
I'm always happy and joyful.
I'm always happy and joyful. The integrative approach that she follows is really more like a conversation. And from that, she gets information from you, and then she takes it from there. And I really like that approach. 73% of our serotonin receptors are in the gut. So our mood has got a very important effect on our gut, our digestive health. So by starting there with a little bit of a detox and restoring their normal bacteria through, for instance, a probiotic, and then looking at what they eat and giving them food that are what I call brain food. I would really recommend people to focus then on complex carbohydrates. That would be oats and muesli, everything that takes a long time to be broken down into glucose. And then focusing or emphasizing what we call superfoods. Now those would be berries, very powerful for the nutrition that we need for the brain and the nervous system. Also nuts. These nuts are pecan nuts and also walnuts. The other one, what do they look like? Do you? A bit like a brain.
Yes, exactly. So that tells you what it's good for. And then on protein level, we would focus on fish, especially salmon and trout, for instance. We would also do the blood tests to make sure there's not a thyroid problem and address that if there is. But very important, the blood sugar, because low blood sugar is one of the easiest things for people to adjust. Ginkgo biloba is an excellent herb for actually many health challenges, among them depression, and it's safe enough to actually even put into an antioxidant combination, but then also to use it as a single herb throughout the tapering process to give the patient a little bit of support while they're doing it. If people are off their prescription medication, I would then prescribe the St. John's wort, which is, there's so many studies to show how effective it is as a natural antidepressant. One of the things I always do is the vitamin D. Now, vitamin D is very essential that in making all our hormones, the sex hormones, all the cholesterol pathways, our mood, a lot of our informational substances or neurotransmitters have got vitamin D in. It becomes part of our cell membrane. So it's crucial in weight control, in mood disorders, is to consider the vitamin D.
It's actually quite amazing that if you give your body the support it needs, which are all natural things, then your body heals you. The whole cloud of depression has just become a non-event. It just isn't there anymore.
As part of the toolkit that I would always give to my patients would be my book, Stress Solutions. So I give people the relaxation CD. It's very simple, breathing, muscle relaxation, visualization, so that people can actually notice that if they are in this depressed mood and they listen to one track, there's an improvement. And that takes them gently on this journey to recovery, to understand, but I am not my depression. Now you breathe fast and deep, and your tummy becomes a bellows, like opening. You are trying to light the fire. Okay, just do it again. Close your eyes. So you get the effect of increasing through this simple breathing your own endorphins, also your feel-good hormones. The chemical imbalance that's referred to is actually a complete misnomer. It's to tell people they've got a lack of serotonin or a lack of dopamine or a lack of acetylcholine. But that is not the cause. Those are all the effects of a much deeper process in the thoughts and emotions leading to the chemical imbalance. The problem with antidepressants is it's often selective serotonin reuptake inhibitors or SSRIs. It only works on serotonin. And important to understand, serotonin receptors are not only in the brain, it's also like in the gut. So you are, with your SSRIs, you are actually influencing the serotonin receptors in the digestive system, which is not a good thing at all. But your problem might not even be there. It might be low dopamine. So that's not even going to help for that. So that's why something like St. John's wort is better, because it comes up higher in the whole physiology or biochemistry of our chemical imbalance, and it adjusts and adapts to the body's need. So it will balance that on any of the levels of the neurotransmitters, not only on the one, because that is why people get so many side effects of the antidepressants, and that's why they don't want to use it, because it's not really lifting their depression, but it's causing a lot of other side effects that they're not happy with. And of course, an antidepressant will not cure the disease. It might cover the symptoms for a while, you know, like a plaster that you cover, but it's not getting into the deeper healing that is necessary. So even if people are on antidepressants, that's not good enough. They must go for psychotherapy, look at their eating patterns, look at how they exercise. Are they using their bodies to help them lift the mood? So to just go for chemical imbalances is a very, very, you know, it's like a very limited view of looking at the whole individual.
What Arien taught me is your body wants to be healthy. That's the default condition. Your body wants to be healthy. And the only thing that you have to do is to support your body in order to be healthy.
A very important point is that people understand that depression is not a life sentence. So even if you're on antidepressant, it's not a life sentence, but you will often be told you've got to use it the rest of your life, which is simply not true. Because if you look at the whole individual and you work with all their areas of influence and you help their body return to its natural state, the day will come that you don't need any antidepressants. We all have our down days and our low energy days and our irritable days. So you don't have to treat our normal human moods, and that's what is happening. So that people understand, you always have to dig a little deeper to get to why you're experiencing more than the normal human lower moods, if you want to call it that. Okay, Esther, I think that's enough for today. So you're ready to work on your emotions, and I've also given you a little bit of a summary of what we discussed so that you can refresh your memory. My take-home message is there's hope, and the integrative approach gives you the tools and the techniques to actually take control over your own mood and then, of course, your health and well-being.